There's so much to cover when we talk about barriers to healthcare for disabled people. I'm planning a 12 to 15 part series, and even that honestly only scratches the surface. So, I want to start with a quick overview of what's coming, not because this is set in stone, but so you understand what we're covering and where we're headed. This series is probably going to take about a week, and some parts may shift or expand as I go on. So, part two, we'll talk about the belief system, the documented reality that many medical professionals don't believe disabled people have a quality of life. Part three, we'll cover how that belief causes harm, how it impacts pain management, treatment decisions, and even whether disabled lives are treated as worth preserving. Part four will focus on sexual erasure and reproductive control, including forced sterilization, lack of sexual health care, and how women and people without normal bodies are treated in medical spaces. We'll talk about being talked over, being talked around, and infantilized, especially when someone else is in the room. We'll cover institutional barriers, doctors refusing permanently disabled patients, pushing people out, or framing exclusion as we're just not equipped. We'll talk about how assisted death is offered when care, accommodations, or support. We'll cover communication barriers like the lack of ASL interpreters and language access for people who speak English as a second language. And then we'll get into the physical barriers, scales, exam tables, waiting rooms, doors, diagnostic equipment, and why so many disabled people are denied care even once they get into an office. I'll share some of my own experiences, not because they're unique, but because they're so common. This series isn't about one bad doctor. It's about systems, design, and decision that quietly determine who healthcare is built for. If any of this sounds familiar, you're not alone. And if this is new to you, stay with me.